problem. Fetal tone is acute problem. So those are the parameters which are more dangerous, and they need to be there. They are also all neurological problems, which means they are telling you what is happening to the neural centers, and if hypoxia occurs, those are the centers which will get affected first. What happens if you have oligohydramnios? Because there has been a rupture of membrane. It is again reliable because again most probably you have chronic problems. Liker is a chronic problem, it will not affect the acute variables. But if your biofetal profile is 6/10, then you know that you lost 2 points because of Liker and you lost 2 more points because other variable went down, and you have to become concerned. This is a very interesting thing, that presence of fetal breathing movements has the highest specificity in predicting an absence of fetal infection, especially in cases where there has been an ROM. Okay, is it reliable in presence of fetal anomalies? It depends what kind of anomaly. If you have a club foot, it is not going to affect your biofetal profile. It is going to be absolutely normal. But if you have a diaphragmatic hernia, then you might have difficulty. Fetus is having difficulty in showing breathing movements. So your BPP can be affected. You need to just keep that in your mind in the background. This is the most important slide, because in the evening at 7 p.m. you can give a normal biophysical profile score and you can still lose the fetus by midnight. And early morning the gynecologist can call you and say that, you did a very stupid scan because you said everything was fine and still I lost the baby. The reason is simple, because there are a lot of things it cannot evaluate. Cannot evaluate feto-maternal hemorrhage suddenly, vasa previas, cord entanglements, abruptio placenta, cord prolapse. These are all the things which are acute. They are called accidents, and they can happen immediately without actually giving us time to respond. What do you do with a score like 6/10? A lot of this depends upon what gestation age you are looking at, what kind of neonatal setup you have, because that can help you in making a decision when to get the baby out. But mostly the logic is that if your scores start going to 6, then your perinatal mortality is rising from 2 to 10. And important to ask, which variable is absent? What is the gestation age? What is the maternal condition? And increase the testing time. Increase sometimes. If in 20 minutes you can't see fetal breathing movements, do another 10-minute scan and see if you can pick it up, because that can give the fetus some more time in utero if you want. But once you start dealing with scores of 4/10, then of course deterioration is rapid and you really need to move in fast. You need to find out good neonatal care. It is important to remember that even if you have scores this bad and you tell the mother or you tell the gynecologist that this is a very, very low BPP, the fetus has this great ability that it cannot predict death. It can still take up to 2 weeks before it can occur. Okay, does a BPP stand over a standalone NST? There are gynecologists who say, I have NST, so forget BPP, I don't really need it. But I think it does, because whenever the fetus comes into ultrasound room, apart from the normal BPP we do, we can always look at biometry again, anatomical surveys, placenta, cord, so many things, and we can always use Doppler evaluation. The bottom line is that we all want healthy babies. So the take-home message is that correct BPP has to be interpreted correctly using all your skills and should be on individual components. What are the components missing? You really would get concerned if fetal breathing movement and fetal tones start going down, and not so much about Liker, for example. And fetal state plays a role, and we have to remember that in our mind. I think with that I shall end my talk and release you for lunch. The baby says thank you for